En première partie, nous allons recevoir Emmanuel Chiangong, que nous invitons sur ce plateau, et pour parler justement de l'association de Cameroun
Society
Socapsi. Voilà, Socapsi.
That's the abbreviation, right?
Yeah.
Socapsi, Cameroun Association.
Société camerounaise des psychologues.
Cameroun Society of Psychologists.
Cathy, hein?
Cameroun Society.
En tout cas, ce sera vraiment... Aujourd'hui, ce sera vraiment santé.
Yeah.
Ça va aller dans le mental, ça va aller dans notre corps. Parce que notre physique dépend aussi de notre mental. Si nous sommes bien physiquement, c'est parce que mentalement, moralement, nous pouvons aussi être bien. Donc, pour cela, pour que nous soyons bien physiquement, on a besoin de travailler notre mental. C'est important. Donc, parfois, nous sommes comme des... Comment tu appelles ça, Cathy? Nous sommes comme des carapaces.
Attends, c'est le nom là que tu voulais qu'elle te dise. Ah, God! Carapace! Hey, Mireille! Mais tu peux me faire ça? C'est comment avec toi? En tout cas, I knew it, I just didn't want to say it.
En fait, nous sommes un peu comme des carapaces et on a besoin de traiter cette carapace-là. Et pour que cette carapace soit propre, il faudrait que l'intérieur de la carapace soit nettoyé.
Okay.
Et on en a besoin. Et je crois que Emmanuel Chiangong, c'est des personnes d'ailleurs, même qui s'en occupent, qui font, c'est leur spécialité. Que ce soit en beauté, la beauté physique, la beauté intérieure, travailler cela. Lui, il est dans la beauté depuis des années aujourd'hui et ça passe par la psychologie pour être membre de, je vais dire quoi, être cliente de lui depuis pratiquement 20 ans aujourd'hui.
I see why you decided to remain younger.
Il a toujours cette approche-là. Et ce qui fait que, je vais te faire une confidence, quand j'entre dans un salon de coiffure aujourd'hui, dans un institut de beauté, et qu'il y a des choses que je constate, je dis, mais attends, je ne suis pas habituée à ça. Nous, on est habitués, quand tu arrives, on enlève tes boucles d'oreilles, on te parle avec gentillesse, on vient te servir un thé.
Ah bon?
Oui, et on te masse pendant qu'on est en train de faire tes cheveux. On finit, on te parle, ça dit, tu sors de là, tu sais, tu es une autre personne. Et quand tu rentres dans un autre institut de beauté et que c'est pas ça, on est brut avec toi. Non, tu arrives, je dis que... Et moi, je dis toujours à ces gens, non, écoutez, moi, je vais souvent. Quand je vais là-bas, ce n'est pas comme ça.
They want to be on the safe side because when you talk of Emmanuel
Chiangong.
They are two different things. Just imagine you go to a new salon, a beauty salon, right? And they do all those things. At the end, they say your bill on the done. Facture de 100 000. Tu commences à m'avaler, commence à crier. Comment ça? When you just did my... Ah bon, madame? Excuse me, when you walk in here, first of all, if they need to massage you a little bit, you need to pay. Drinking our coffee, you need to also pay. If you want this kind of services, you need to...
En même temps, je crois aussi, Cathy,
but those are customer services.
Si tu veux mettre,
yeah, those are kind of customer services that are just so simple and attractive. Trust me, if you have such in your place, you're going to attract a lot of people. You will. Even though some of us are not used to, we'll just get boom.
Et c'est dans les salons Viva Coiffure que j'ai appris que le téléphone, on ne doit pas entendre le téléphone sonner.
Pardon?
Vous ne parlez pas.
Ah bon?
On ne parle pas. On communique avec les gestes, s'il te plaît.
Quel genre de... Je ne comprends pas.
Comme ça.
Attends un peu.
Non,
le téléphone de qui?
Le téléphone des employés.
Ah, ok. Yeah,
ça ne doit pas sonner. Oui.
Wow.
Donc, ça veut dire que tu ne dois pas perturber le client.
Wow.
Seul le client peut avoir son téléphone et parler comme il veut. C'est lui qui est roi.
Wow.
Et ça, c'est chez lui que j'ai appris. Et quand on parle, et quand on est chez lui, c'est quand il veut parler, tu as besoin de ça. Claquement de doigts. Et tu as les autres qui sont là, au gardez-vous. Elles doivent être attentives, mais vraiment... Mais alors, est-ce que tu vas alors voir les instituts se comporter comme ça? Dans d'autres salons, c'est le commérage, c'est... On bavarde ici. Toi-même, tu sors de là stressé.
After your massage.
Les gens bavardent. On parle dans le salon.
It's like
alors,
walking in a salon, you're healthy.
Pour te détendre.
avoir, comment on appelle ça, les maux de tête.
Oui.
Just because of noise.
C'est peut-être parce qu'il a compris ce que c'est la psychologie.
Yeah.
Il a compris la psychologie de l'être humain. Il faut traiter l'être humain, l'intérieur. Et ça, c'est ce que j'apprécie chez Emmanuel. Emmanuel Chiangong est déjà là, bien sûr. On a tellement parlé de ce qu'il fait. Voilà. Et maintenant, Emma, bonjour.
I like that. Emma, tu vois ta personne, tu vois. Ça...
Emma, bonjour.
Ouais.
Bonjour.
Tu n'as pas l'habitude de m'inviter sur ton émission. Donc, tu vois, non. On aurait déjà eu nos propres habitudes.
Je t'ai dit.
Ok.
Non, mais c'est la convivialité entre toi et moi.
Effectivement.
Voilà.
Et puis le
ça
travail...
fait quand même presque 20 ans.
Presque 20 ans. Et félicitations.
Ah, ouais,
être fidèle, être constante, être... It's beautiful.
Thank you.
Yes, yes. It's one of the great things that STV has done in the media world, you know, building people. I meet Erin Gando, I meet Zol. You know, it's beautiful.
Thank
you.
you.
Great.
20 years, man.
Absolutely.
Nous, on est fidèles, on est loyal.
Some of us are media
Ça
prostitutes.
shaking, quand ça bouging, no bouging, on reste sur place.
Some of us are media prostitutes.
Cathy, je vais couper ta bouche.
To cut myself from that door. I don't want to be again, no.
Cathy, c'est quand tu comprends ce genre de choses, hein, ça dit, ça sert à rien de... On va peut-être te taxer de quelqu'un qui n'a pas d'ambition, mais ce que les gens ne comprennent pas, ils ne savent pas, ils ne peuvent pas comprendre où tu es en train d'aller. Parce qu'il y a des choses que tu fais derrière, tu ne fais pas du bruit, et il y a des choses que tu fais derrière.
That's correct.
Il faut qu'on comprenne que ici c'est la télé, tu travailles, c'est un boulot. C'est comme si je travaille à la fonction publique et puis j'attends ma retraite. Et à ma retraite, ce que j'ai préparé, je me lance dans mon second métier de retraite à plein temps. Voilà. Emma?
Yes, good to see you.
Good morning.
Good morning. Yes, of course. Yes, yeah. I was enjoying you guys.
Thank you.
On parle justement de la psychologie, etc. Ouais. Je sais que tu es dans ça depuis des années, tu évolues déjà dans ça, tu faisais ça. Mais et maintenant, vous vous êtes regroupés en association pour pouvoir maintenant ouvrir ça au public, faire connaître ceci au public. Alors,
je pense que c'est excellent, c'est très beau. D'ailleurs, c'est comme ça une société organisée fonctionne. Je sais qu'il y a une direction, un leadership et une direction où il va. Et on va faire notre effort d'être compté parmi ceux-là. Je ne suis pas membre de SOCAPSI, je suis membre de Cameroun Association of Clinical Counselors. Mais SOCAPSI a fait quelque chose de très beau, c'est-à-dire il a pris le leadership d'organiser ce congrès national. Il a ouvert ses portes à inviter toutes les psychologues praticiennes dans le pays. Et ça, ça leur donne naturellement leur place. Parce que quand vous êtes un leader, il faut cette ouverture, il faut cet esprit de partage, d'appeler à l'action de groupe. Et donc, on reconnaît ça. Et pourquoi on est tous venus. Le président de notre association, Dr Pepetra Fonki, a mis tout de suite l'invitation dans le forum. Et il y a un grand nombre de nous qui ont commencé à participer parce qu'il y avait un lien pour des réunions. Et c'est dans ces réunions que je participe, tous les dimanches à 19 h. Et les psychologues camerounais, même du diaspora, participent. Et c'est comme ça qu'on est en train de construire et se faire connaître, parce que c'est formidable de connaître qui sont tes collègues. C'est un métier qui ne se pratique pas seul. Vous voulez ou pas, vous aurez besoin des expertises parallèles avec lesquelles vous pouvez apporter des solutions à des personnes qui vous sollicitent. Parce que quand on vous sollicite, des fois, votre intérêt, when you are client-centered, your interest to get solutions. Sometimes we want you to look for expertise from your colleagues. You know, that's the case of referrals, or you co-therapies. You know, we have those type of approach. Il y a des co-thérapies, mais il y a aussi des référents. Voilà.
So talking about this conference, when is it starting? When
Beautiful. This conference will be 18th and 19th. That's Friday, Saturday coming. And it is not late, dear friends. I have not found, you know, the truth is that SOCAPSI has been a lot more of French-speaking psychotherapists and psychologists, and the Cameroon it's an organized bilingual country. We need professionals from all the parts of the country. So we have some English speaking, and that's why the president of association, got us into the dynamics. And whatever happens, a client can receive services in Yaoundé, and the next day is in Boya and needs a service. He will find somebody, who is still. So when you have a society that works we can coordinate and organize the profession as all the other professional bodies. We have the medical council, we have the bar council, we have the society of engineers and so on. So the psychologists are actually going into that dynamic now. And so we are really inviting all the English-speaking psychotherapists, psychologists who are not, knowing that Professor Bame of late was one of the biggest dynamics in psychology in this country. And so he actually taught me terminal disease counseling. So when we have very powerful mentors who have led psychology and psychotherapy in our country from the English-speaking, we should keep that dynamic going.
Okay.
Yes.
We heard sometimes that it's kind of difficult to meet with psychologists like Mira and I were discussing, and even psychotherapy. So what is the how available are psychologists and psychotherapists?
Okay, I like what Muriel said. It is again the way the professional bodies are functioning.
Okay.
The person that has the competence, who doesn't use it, cannot be expecting the novice to be more efficient.
That's true.
When you raise the issue of postpartum depression, and you were saying that the gynecologist should be able to talk to, to patients that you may have this thing, but Muriel said
it is not his
it is the gynecologist to refer the client, or the clinical operation should have a psychologist as part of the clinical expertise that is serving the clients that come on board. And I have, in my clinical practice, I worked in the Acha Hospital, and I worked in La Quintini. And that is actually what happened. We had a lady that was pregnant, and she was supposed to have an intervention, and she doesn't want to be operated. And so the medical administrator called me. I was on practice. I was still a student. He said, Emmanuel, we have a situation here. This lady, if we don't operate her by tomorrow, the baby is having a complication. The baby is deformed, and we don't want to tell her that. But if we do not take off this baby by tomorrow, we may lose her.
Right.
I'm still a student. I'm in practice. I'm in internship. And they said, well, that's your case, please.
You need to handle it.
Yes. So he is the gynecologist. The medical administrator is the gynecologist. He's waiting in the theater for the patient to come. And so I had to meet her and talk to her.
That's cancer.
I had to get her to understand. Like I say, I tried to know, how have you enjoyed your services here? He said, wonderful. They are doing well. And I said, do you trust them? He said, yes. Have you been happy all through? He said, fine. But the doctor says you don't believe in her, in his decision to go on in a C-section for this case. He said, I've never had this. I've always been scared. I said, it's like a phobia. So we build back our confidence in the hospital and in the doctor. And at the end, she asked me, will you be in the theater? I said, of course. You look at that. Which means that we have other things apart from the biology of the body, the physiology. That dimension of the human being that is not just the flesh and the blood, which we call the mind and the spirit. And from there, she needed attention. And this gynecologist knows that. And that hospital knows that. And so they put that team in place, and that is how it went. So really, you may say that the public doesn't know why they need to see a psychologist, but also our medical and human care practices are not applying the rules as it has to be. It is also a process. It was not the case everywhere. Every part of the world have had to go through this state, and today with the Congress that is coming up, we are going to educate ourselves.
Yeah.
We are going to educate our colleagues in other fields that
Very
are
important.
and we are also going to educate the public about that.
You make mention of the fact that psychologists, Anglophone psychologists, do not, or they don't participate on the conference. I just want to understand: is it that they are not informed about it, or maybe they deliberately do not want to get involved in?
Listen, this is a dynamic. You know, it's a dynamic that is. Even I am not sure that when you look at all the practicing French-speaking psychologists, they are all on board yet.
Okay.
Yeah, when we see that in the meetings, I don't think everybody is on board. But you see, I have the interest, having worked in the Anglophone academic system, to sensitize my colleagues. You know, we have some on board, but we have Dr. Gordon in Boya in the university. We have also students in the university.
Dr. Gordon, Tasha? Dr. Gordon?
Dr. Gordon, I don't have his other name, yes. He's in Boya, and he's very active, he's very, very dynamic, and I'm looking forward to meeting him in person. You see, you see that. So what I'm trying to point out is that it's a dynamic that is gaining grounds as we go along, and it will, and right away on our association, I have my president who is out of the country. She will be intervening online. I have Dr. Ndongde, who will be coming in from the Baptist Hospital. He's a very, very experienced clinician. He has not been in the meeting. So we are now pushing, you know, the dynamic. So what I think most have not been informed. Some are informed, but they are so involved. The level of interest, you know, when you meet practicing psychologists, they can be overwhelmed with work. You know, their job is very demanding and they can really be overwhelmed. So if you meet people who are already involved in very heavy projects, they are having the trouble of creating time to take part, but we are pushing. So it is a call that is radiating in the whole country and beyond. You know, I've been talking to two colleagues in the United States and trying to see how they can connect online. You know, they are Cameroonians, they are practicing out of the country, and we have Dr. Juliette, who is on the forum every Tuesday working on Zoom with us. You know, this is beautiful. You know.
Alors, ça va se tenir où précisément?
It's going to take place at the Saint Michel occasion. They have an event venue there, but at a very big
Collège
event.
Saint-Michel.
Yes, at the Catholic Center, they have a very vast, you know, we are expecting a very big crowd of people, and when we looked at the venues, we were contemplating some hotels around town, but when we look at the fact that there will be stands for professionals to expose, and we want everything in one place, we got that venue, which is going to be a beautiful discovery for most of us also. But the logistic committee has given us the assurance of how they can accommodate the whole thing for 2 days. So that will be at the Catholic Saint Michel. Yes.
Collège
Saint Michel community. It's at just after Chococam. You know.
BBR.
Yeah, exactly. Yeah, BBR. Yes. That's where we'll be congregating from all parts of Cameroon. We have delegations.
Mais je crois que c'est pas au collège Chevreul là.
I will not give you the exact, but I know that it's a known hall. Most
on appelle le quartier Saint-Michel, mais je crois que c'est à collège Chevreul. À l'intérieur, quartier Saint-Michel, mais collège Chevreul.
Only
c'est à côté du BBR.
Yes, exactly. That's where it is. Exactly. You know, I've always been hearing Saint-Michel, so that was.
Non, c'est le collège Chevreul en fait. Et je vois un peu la salle. C'est une très grande salle. Voilà, j'ai présenté un mariage là-bas.
Il y a beaucoup d'événements qui se passent là-bas. So we'll discover that, and we are looking forward to meeting also the public. You know, we have people like.
Le public, c'est
important. You were talking about this case that my colleague will be coming out to Paul will be coming up to talk about very soon. These are situations that when you go to forums like this, you have the opportunity to meet the professionals. You have the opportunity to actually, discuss with them, share, ask even the most stupid questions, and then you are happy to go home and reach. Yes, exactly.
Very much. Thank you very much for passing. Merci d'être passé. Et surtout, on retient que ce sera le 18 et 19
Le 19,
août.
We have participation fees that went up a bit because we gave some bonus fees, and then from the 13th, it will be plus 50% on 5,000 for students and plus 50% on 10,000 for the public. And of course, professionals are paying 15,000. They will certainly pay their extra for the lateness.
En français, on va dire que c'est 5 000 francs pour les étudiants.
Oui, mais ils vont payer, parce qu'ils paient en retard, ils vont payer 50% de plus. C'était ça. Parce qu'à partir du 13, on avait lancé cette chose comme une promotion. Et beaucoup en profiter. Donc, les retardataires vont payer 50% de plus.
Donc, si c'était 5 000 sur 5 000 francs,
ça va être 7 500.
Ça va être 7 500. Donc, 2
oui.
500 supplémentaires.
Oui, et puis pour le public, ça sera 15 000 maintenant.
15 000.
Et puis, oui.
So it's open for anybody?
Yes.
Okay.
It is important to be knowledgeable about your mental health. About your mental health. La santé mentale, c'est pour tout le monde. On en a
véritablement besoin au Cameroun en ce moment parce que tout le monde est en train de péter un câble. On est comme sur une dynamite prêt à exploser. Donc on a besoin de ça pour essayer de se contenir, de nous contenir parce que la colère, la révolte est en feu.
Effectivement.
I don't know if is it okay for you to give us like maybe a brief rundown of the different activities that will be taking place?
Okay, may not everything, but not anyway, we have the official opening of the event, which is going to be patronized by the Ministry of Health.
Okay.
The Minister of Health, they have given their approbation directly for that. They are endorsing it. We also have invitees from different states. We have different events that will take place. There will be a C award for some of the most brilliant psychologists that have been working in the country. They will receive awards. We have conferences. We have scientific papers that will be presented. We have workshops that will develop different themes. And then we also have a special workshop, which I have been working on that workshop for developing your own on-the-field experience on how practicing has been going on, so that we can build up the Cameroun Code of Conduct. There's an ethics committee that will have to build a code of conduct and also a guide. Looking forward to producing a guide that will help young psychologists in universities and young practitioners to be able to be inspired by what all the others have done. So it's going to be a jam-packed 2 days of hectic activities. And of course, there will be stands by different organizations that work in mental health, associations, ONGs, which you can visit. And I'm sure there will be books that will be displayed there that you can buy, and then meeting professionals, having one-on-one exchange and so on. And then there are a lot more other surprises that you should be looking forward to.
De toutes les façons, on ne dévoile pas les surprises. Il vaut mieux être sur place pour découvrir la surprise que nous réserve la Cameroun
Société camerounaise.
La Société camerounaise.
Cameroun Association of Practicing Psychologists.
Voilà, c'est bon. En anglais, là, c'était bon.
Non,
Society of...
Il a dit
Society.
Non, mais il a dit, c'est bon pour moi. Ça va, c'est bon, j'ai compris.
Mais moi, tu veux comprendre, non?
Non, comprends, ne parle pas. Fais comme moi. Comprends, tu ne dis rien. En tout cas, merci Emmanuel.
My pleasure.
C'était un plaisir. Voilà. Et bonne fête de l'Assomption à tous ceux qui célèbrent l'Assomption ce matin. Et pour cela, justement, on est allé faire une petite recherche, aller découvrir ce qui est autour de cette Assomption-là. Voilà, les chapelets, les gadgets, etc. Donc, non, on fait tuer pour le marché ce matin.